no presentation. Conversation for me is much more valuable, just interactive. So, hey, I'm Dr. Ron Ribitzky. His address is Ron, or Dr. Ron if you insist. Formerly physician, practiced medicine for 10 years before transitioning to healthcare enterprise IT here at Boston Children's, Harvard Medical School, Medical Informatics. Fast forward, CIO twice. As I mentioned to other folks earlier, I see that as 2 tours of duty, because like military, because CIO in healthcare is a wicked hard problem, as we say that in Boston. 2 tours of duty as CIO, UMass Medical Center and Ambulatory Center at Emory. And then I crossed the line, fast forward to cross the lines to the bad guys, to the vendors, to the electronic medical record space, Eclipses and others. Of course, I'm joking, the bad guys. Fast forward throughout a number of different startups in different roles, co-founding, patient experience, patient satisfaction, and then senior healthcare strategist worldwide for Intel Corporation. Once upon a time, Intel decided that something has to be done on a worldwide basis on digital health, because healthcare is so, as we talked about, healthcare is so behind the curve in terms of catching up with all the fascinating science and new drugs and new approaches, but data and technology holds us back, right? So Intel decided to start a digital health group to advance adoption of technology in healthcare worldwide. And I was the senior healthcare strategist for the group, focused on provider segment particularly, but also payer and pharma. As I mentioned, the project with MOH, Ministry of Health in Korea, that worked with them. So that's the background. That is to explain to you, to give you some insight with regard to why I ask certain questions and why I approach certain problems and solutions the way I approach it, because I see that as a cross-functional kind of a thing. Last week, I was asked to come on a podcast, and the focus was I agreed so long as the title will say the word pragmatic. Everything else I don't care, but it has to be pragmatic. And indeed, the title is pragmatic innovation in digital health, right? And I try to make the point. I'm still trying to make the point of the big difference between shiny object, right? Can you think about one? ChatGPT, right? Shiny object and pragmatic innovation. And for me, pragmatic innovation usually starts with a shiny object. But as I kind of ask my team and people who I team up with and investors and say, hey, guys, ladies, at a certain point that we're in a shiny object, we live very deep in the computer science department. We live very deep in the technology R&D. Everybody is excited about the technology marvel. So the difference between this and the real world is, hey, let's figuratively speaking, stand up, go through the door, leave where we live, cross the street to where the users are. Right? To understand what will it take to take this new marvel, growing cells, right? New marvel, and implant that English second language. It was intentional, implant, not implement. Implant that shiny object in a living, breathing environment where the users live. And figuring out what does it take to make it work end to end for the user. All right? So that's the context. So let me ask you a couple of questions. Does anyone know your health and wellness score? Nobody? You know your health and wellness score?
I have, about 2 years ago, and I ran a full panel, and there's some AI that you plug in various measurements or calculations, and it says your physical age versus your actual age.
Yeah.
Or your biological age.
Wow.
It was fascinating. Like, it showed up that I have my chemistry is of a 24-year-old.
Yeah.
I'm 52.
Yeah.
I was fascinated. This is happening.
That's in your favor.
Oh my God, yes.
So
It's amazing.
So what's the valuation of this company right now? Did you turn it into a company?
No, I just found it out. It was just for fun, right? It was just for fun, but it's there, right? I think your lifestyle, they all influence things.
You kind of, the idea is there, but we're not
Yeah.
there.
Yeah,
Bottom
we're-
line, would you agree with me that?
Absolutely, we're not there yet.
I got to tell you that with that, I teamed up with my client. I'm the entrepreneur in residence for Alphin Software Solutions, right? So one of the things that we focused on first is in the context, think about whole person care, like what I think you did, whole person care. Intelligent techniques and technology, you used AI, right? To try to make the data make sense, right? What happens to us every day, pretty much for all of us, right? So somebody's taking care of us and we get a link to the portal, right? We get a link to the healthcare portal. We click on the link, what do we find ourselves? We find ourselves drowning in the consumer-facing electronic medical record, which emerge as a #1 factor for physicians' burnout and a key problem for physicians leaving the profession, electronic medical record. Now, organizations took it and threw the kitchen sink at us, we the people, at us the consumers. So we have tons of data, we have an ocean, they ask us to board, but nobody answers the questions, allows me, allows you, all of us to answer the question, how am I doing? Not how my diabetes is doing today, not my glucose measure, not my BMI today. How am I doing? I'm wrong, I'm a whole person, right? And you were, so the next question, and except for you, I gotta tell you, give you credit. Everybody says no. I don't know why, and I didn't even try. It didn't even occur to me because people are going through the crowd, through the lanes, because that's what they were told. Look at the EMR, check your lab tests. So what? So then I have a follow-up question to say, do you think that your primary care physician knows your health and wellness score? No. Right?
Quick question.
Yeah.
On the comment or question about the health and wellness score, is there a single scale that's universal, or what are you referring to?
What I reference to is unmet market need.
Okay.
We at Alphin, we work on it, and we presented the early work on that publicly in November in Virginia. But this, you introduce one of the complexities. It's a wicked hard problem because I don't anticipate any standard in health and wellness score. Well, it's almost like, phase 1, 2, 3, we have to go through so many gates, right? So first of all, can somebody come up with a health and wellness score? And we did, my client and I, Alphin Software Solution, yeah, we did, right? So let's come up with a health and wellness score. And it is something that will evolve. Our body is very dynamic, right? It's changing, it's not static, okay? It is much more dynamics than finance world and your credit score, right? So the answer usually is no. Primary care physicians don't know health and wellness score. So that is for me as a physician, critically unmet market need and emerging market opportunity, all right? And this is deep in the digital health. Change subject. Not totally subject, but let's go to the other screen. How many people are diagnosed every day with cancer in the US? Have any idea? Just throw a number.
100.
How much?
100.
1,000?
1,000.
1,000?
50,000 or so.
4,700.
47.
4,700 day after day after day being diagnosed in this country.
This is worldwide or US?
US.
Oh.
US. Worldwide, 60,000.
Okay.
How many people die in the US every day from cancer?
That's gotta be a lot.
1,600 every day with suicide.
1,600.
Right. What happens when, God forbid, somebody, like 2 minutes ago, an hour ago, somebody here in Boston or anywhere in the world was diagnosed with cancer, was told, hey, you have cancer. If you throw the network effect on this, how many people it impacts immediately? Family, friends? 5, 10 people immediately get into this shock, into this devastating. What is usually the question that comes to everybody's mind?
How much time?
How much time?
Severity?
Severity.
And then what type?
What time?
What type of cancer?
And these questions, what should, I'll try to push it a little bit. Where they should put us to, what can I do about it? How much I have to live, which means, okay, I already give up, I'm gonna die, not going to die. What's the cause? Okay, so now I know the cause. What do I do with this information? What are you talking about, like this? So, if you do the math, my take is, and the numbers of course are growing around the world, my math says within every week there are 500,000 people impacted, right? Quickly you do the math. Right? So this is one of the things that I'm trying to raise awareness that this is, again, unmet market need and a very, very quickly emerging market opportunity for we, the people. We, the people. Not only the scientists, not only the great researchers at Dana-Farber, right, and the like, or MD Anderson, right? But we, the people. So billions and billions are going into basic science research, into developing the new drug, into developing the new protocol. Right? But somebody was just diagnosed down the street in Mass General B, right? Was just diagnosed. How can they find out what treatment may be best for them, as we heard from Prius? Every person is different, even in diabetes, even in obesity, so is in cancer. So we used to think about, oh, genomics is a great breakthrough, and it is. But this is no longer the hottest breakthrough, because we moved from genomics to multi-omics. Genomics, proteomics, metabolomics, epigenetics. Right? So it turns out there's a whole section of science, life sciences, that combines basic science, genomic sequencing, multi-omic sequencing, and the clinical aspect. Okay, there's a whole section around the world with discoveries nearly every day, if not every few days, that says, oh, so small cell lung cancer, that's very common. I got to tell you a personal story. My childhood friend calls me one day about a year ago and said his wife was just diagnosed. Out of the blue. No presenting symptom. Just she had a little bit of cough and the doctor said, let's do X-ray. Stage 4, lung cancer. So you can imagine frantically kind of going online searching. I know a little bit about search. I'm the first person in the world who took search engine before Google was even conceived, search engine, and implanted that within the clinical documentation life cycle here at Boston Children's, a few blocks down the street. So I know about search. Right? So I went and precision medicine. So I went frantically in it. Fast forward, we found a team here in Boston. And because I was a flight surgeon, I know what does it take to do medevac. and I have connections, right? Few phone calls, and my guys just were lined up just to do Medivac International, to bring her to Boston. I got her picture out of the, it was in January, out of the hospital. It was a sunny day, winter sunny day, and she was all smiling. She had so much hope, and she felt good. And we lost her 2 days later. We couldn't even get her to the aircraft to fly her private here. Right? So this all happened in 104 days from diagnosis to death. How long do I have? Right? Which illustrated the case again and again and again. And I'm talking now about the project PRECiZiUM that I'm in the process of putting together. About reminding all of us that it is about all of us, not just, the researcher and the drug development. It's about us, we the people. Okay, so think about consumer-facing service that answers the question, people question, hey, diagnosis cancer, what can I do about it? And case in point, in small cell lung cancer, there are about at least 4 or 5 different drugs and different protocols. And the decision nowadays is so simple. Why so simple? Because we know it. Because those experts in multi-omics that are multi-sided, they don't normally live in the same organization. It's also multinational. We know it. So long as we get the multi-omic signature of this small cell lung cancer, we know that this drug, like that, in a matter of 2 minutes stop from strategizing the search and getting the result. This does not exist. Prince, like you said, this does not exist. Small niche things, a shiny object, yeah, but not in something that is globally scalable. Case in point, Illumina is the world leader manufacturing machines that do this multi-omics testing, right? Those of you know JP Morgan Health, every year, just a few months ago. So Illumina makes the case at JP Morgan Health. The single largest segment of genomic and that goes multi-omic testing is oncology. The single, yeah, there are segments of like nutrition and obesity, traits, 23andMe. Some people call it entertainment genomics, but I'm talking about we the people medical genomics, I say. So $80 billion in the next kind of give and take 5 years is the single largest. And when you look at the charts, you know, the bar charts, so you see the different segments like this. In oncology, multi-omics is this, right? We have a lot of work to do. And from a technology standpoint, I would maintain, given my hands-on roll-up sleep experience, we have the technology components to do that. I mean, to assemble that and put this to work. But then here comes the third question. How can we, the people, how can you trust the data? How can we tell? How can we tell that we can trust the data? Any idea, any thoughts? What do you do today? You get a website, you get a new shiny object app, everyone says cool, the visual is great videos. How can you tell you can trust it?
Isn't kind of medical journals and peers kind of what was commonly used to verify?
Yes, yes indeed. Oh yes indeed.
I heard there's a lot of ChatGPT in that actually that's generating those. Actually, it's like 80% of all those are generated by somebody heard that recently, but I haven't heard that.
Okay. Now, okay, this is Pandora box, right? Can of worms. All right, let me start with a simple one, and then we'll dive into the ChatGPT. There is a problem, and a growing problem, in peer-reviewed journals, and it's called retractions. Right? I don't remember off the top of my head the statistics, but I can tell you, principally, you might shed more light to this. Rate of retraction
It's ridiculous.
going up.
Yeah.
Going up.
So,
And accelerating, not just going, accelerating,
Yeah.
right? We call it exponential, right? Turns out that when you do analytics, and there are people who do analytics on which articles are being retracted, on which subjects, and whose articles are being retracted. First, so I'm giving you semi-quantitatively, I regret I don't have the number, but semi-quantitatively, cancer and cancer treatment is top of TA, therapeutic area, is a top TA of articles, peer-reviewed journals, New England Journal of Medicine, everybody, they're being retracted for many reasons. Some reasons are, it happens, people make errors, people make mistakes, but some are simply corruption.
yeah.
Simply, right?
100%.
Simply corruption,
Very true.
right? So
Yeah.
that takes care, so no longer I lost trust. So yeah, I do go to PubMed, this is usually my first thing, just to get a sense of something if I don't know enough about the subject, and I don't know a lot about many subjects, so I'm going there. But then let's go to ChatGPT. I mentioned that also in the podcast last week. So I'll give you an example of shiny objects. About 5 years ago, blockchain showed up on the healthcare stage. Blockchain existed before, but it made a splash into the digital health and medicine, healthcare around the world at about 2018. Cut long story short, I led a team, cross-functional team, multi-company, writing an article, a statement, a position statement of pragmatic, no surprise, pragmatic consideration of blockchain in healthcare. My concern was, and still today to some extent, when blockchain showed up, it was shiny object, I started to hear and read from people who are typically reputable, influencers, recognized, established people, to the effect, not these words, but to this effect. Thank you, blockchain, with or without crypto. Thank you, blockchain. Blockchain will solve medicine. Everybody can go home, Oracle, go home, blockchain is it. Blockchain is going to solve healthcare. Did it? No, not really. Do you hear so much about blockchain healthcare today? Not so much, here and there, right? And from an investment standpoint, talking about capitalization and valuation, if you look at the valuation records of those companies, I referred to that as the drag race, the car drag race. Starts with a huge fanfare, a lot of fire and noise, and they start running, and 300 feet later, they stop. That's exactly what came to my mind when I started to watch valuations of startup companies, blockchain going up and long term, up and long term. 5 years ago. 5 months ago, ChatGPT. And what do you hear? And people write, physicians, very established people, knowledgeable, to the effect that, hey guys, everybody can go home. You don't need it. ChatGPT will solve all problems. Axios actually had seriously hilarious and sad articles. So they asked ChatGPT to generate, it's generative AI, to generate a statement about the T, MBTA, those, MBTA is an underground kind of thing, sometimes over the ground. A lot of problems. So ChatGPT generated a beautiful article about MBTA. There was no word, zero, no word about the problems with MBTA. Nothing. So I took that and I posted on LinkedIn and I said, so now let's imagine that MBTA is you. And you ask ChatGPT to go to look at your medical record and answer the first question that I ask, how am I doing? Would you trust ChatGPT to go and tell you how you're doing? I don't know about you, but I would say definitely no. Now, it's new and people, ChatGPT environment is complex. Let's not make it a discussion about ChatGPT, but very shortly. ChatGPT is just one small user experience kind of a thing for a person to interact with technology and with data. Conversation. ChatGPT is a conversational tool. That's it. Text messaging, right? Interactive intelligence. The problem that I have as a human being and as a physician when we talk about healthcare and what's at stake is that ChatGPT is a closed box, black box. Right? A question comes in, answer comes out without explaining. Right? So, for example, I asked, I went to OpenAI, and I asked how many genomic tests are there in the world today? The answer was about 5,000. Well, market research from a number of different sources claim that there are now nearly 150,000 genomic tests and going to rise into about 475 in about a few years. But ChatGPT tells me there are about 5,000. And I had a follow-up question, like where does this come from? What's your reference? Why do you say that? I'll say, this is trusted information because it comes from NIH. And Ron, NIH is a very reputable, very reputable organization. Okay, so there are problems in ChatGPT. So just to close, we need to wrap it up. So I asked 3 questions. Do you know your health and wellness score, or does your PCP, primary care physician, knows your health and wellness score? And the answer is no. Except for you started to crack the problem, right? We need more like you, and we need more like Alpha in Software Solution, my client that I'm entrepreneur in residency and work with. Question number 2, what can we do when we are diagnosed, God forbid, with cancer, or somebody, family, loved one is diagnosed? How can we find out what treatment is there? And the last one that we did not have enough time to go deeper into, how can you tell you can trust? How can you tell you can trust the data? And so on. How can you trust the methods? We talked about GPT methods that generated the data. And how can you tell that you can trust the sources? Those who used methods to produce the data. Now, perhaps because of my military background as a flight surgeon in the Air Force, right? My dots connect to say, oh, we have a military intelligence problem on our hand. Give it a thought for a moment. We have, in digital health and trust and so on, we have military intelligence problem on our hand. Why? Because my knowledge about this military intelligence is that they have the dilemma of, can they trust the data? Can they trust the methods? Can they trust the sources? And guess what else is happening in military intelligence and in digital health? The frame of reference is changing on us constantly, right? So people react to me and say, yeah, so Ron, this is a kind of multiple moving targets, which I acknowledge, say, yeah. But think about multiple objects, moving targets, but your whole frame of reference is changing not only 3D, 4D, the time dimension. Right? So the bottom line is my call to action, our call to action to the industry, and to beginning with the people, because if it will not come from the consumers, it will only pretty much work for the payers, the big players. But I think that we are the biggest players. Each one is small, but we're the biggest players, we the people. Call to action, health and wellness score of a whole person care. Okay? Consumer facing, multi-omic knowledge services to guide what can I do about it, God forbid somebody was diagnosed. And we need to develop executable, now it's a techno speak, right? Executable, machine executable models of trust. So when we go to the PubMeds, when we go to a source, we will also have a credible, trusted by itself, call it maybe a score. This is very trusted. This is not trusted. There's information, but apply some discount, like investors, right? The princes of the world, or all the world come and say, oh, wow, I want I need 40 million, at this 90 million valuation. So each investor has their discount factor. Say, oh yeah, Prince, I'm picking on you just because it's a real world example. We love what you do. It's high impact, all right? We want to see that happen, but we will do all the calculation based on $68 million, right? Not 90. So the executable model of trust, as I envision that, is something that will tell us how much we may want to discount the trustability, the dependability, trustworthiness of the data we see. Thank you for listening. Questions?
I have some thoughts on the generative AI content.
Yeah.
So definitely, I don't, like ChatGPT is like generative AI, so it doesn't like it actually, like I heard, it makes up answers if like you don't like it makes up answers many times, and like one of the OpenAI researcher actually says like if you say it's okay if you don't know the answer, it won't make up answers, but still it's very imperfect. So definitely agree, but I think like ChatGPT is a generative AI and depends on human input, and human input like so it's like very imperfect. But there's like a new AI right now, constitutional AI, that's like scalable AI, and it's based on like AI oversight. So you don't think there's applications of AI at all in healthcare and in terms of like examining large amount of big data and making sense of it. Not saying it's like 100% accurate, but I'm saying like there's other types of AI model that's not generative AI.
So are you pretty much asking me if I don't think that there's role for AI in medicine?
Yeah.
You showed the picture here of the eats. Thank you guys. The eats, you showed a picture, iPhone taking a picture of the food, a number of different items.
Yeah.
And as I saw this picture, I said, this is what got me started. Way back when I was a physician, going into basic science research, rotation, and I was fascinated by presentation, Professor Rudy Shapiro, Vice Minister of Science, that explained to us he worked on AI models that will be able to determine that there are three objects, one over the other, and figure out which are this object, which is pretty much, I think, what you do in EATS, okay? And that fascinated me, and fast forward the parallel processing in AI. My first ever software that I wrote was AI in medicine. I started it carried us throughout. AI for differential diagnosis in pediatrics failed to try with IBM Science Center and Weizmann. So the short answer is absolutely yes. Right? We got to use AI. We got to use large language models, domain specific. Right? We've got to be very careful treading the notion of, oh, let's democratize the data. Right? Okay. Do we want to call the crowd in Boston and go to the town square and say, hey, how well am I doing? Can you vote about it? And they don't know.
Yeah.
Nothing. So we want specialized, and you talked about the supervised. Another aspect, we don't have the time to go deeper, but I'd love to follow up. Things are going into the answer is the supervised, domain specific, large language model, semantic services framework to assure semantic integrity over time, particularly in healthcare, as we know it. ICDs are changing, CPDs are changing over time, so maintaining the temporal integrity of the meaning of what does the data mean. And I think I'll wrap it up with prompt engineering. Okay.
Engineering.
Yeah. Prompt engineering, which
Prompt.
means prompt, which means
Command line, like prompt, command line.
almost the idea. Prompt engineering is the human, what we used to say in AI, human in the loop, is an engineer. There's a new branch developing of jobs, right, entire development in the AI branch to become prompt engineering, which means to design the algorithm in a way that will prompt the generative AI tools at certain points under certain conditions. Okay, so this whole new fascinating space that develops very, very quick. All right, I think that we need to allow time for other folks as well, right?
Well, we can have the coffee break and we can.
Okay, thank you.
Thank you.